You're listening to the Beyond the Prophy podcast, where we help you out of career burnout so that you can reclaim your personal freedom while pursuing your passion. I'm your host, Jasmin Haley, entrepreneur, influencer, and educator that will help empower you with our interviews, strategies, and straight talks. If you're ready to push past your comfort zone to your greatness, you have found the right podcast. Stay tuned and listen in. Hey, this is your host, Jasmin Haley, and we're here for a impactful and I would say one of the most heartfelt interviews that we're going to have. And you know, I like to get down to the nitty gritty of what makes us human beings and to connect on a deeper level. But this week's guest is Lisa Zimmer. By trade, yes, she is a dental hygienist. She's been a dental hygienist for 13 years, 20 years though in the dental industry, and she is a CEO of Smiles for Recovery. So I met Lisa about 2 years ago. I think it's 2 years ago. And she came to my course that deals with substance use disorder and opiates and what dental professionals need to know and how to use naloxone and all of the things that are very important for us to understand with this vulnerable population. And I was touched beyond belief with her transparency. She opened up, I think that may have been her first time, to such a large public audience about her own experience with substance use and how it impacted her personal life and some of the challenges that she faced during her career or the beginning of her career as a dental hygienist. So she's going to share that story with us. She's also going to share the why behind Smiles for Recovery. So I want to extend a warm welcome to you, Lisa.
Be here. You're one of my favorite people on earth. So thank you for having me.
Yes, I mean, thank you. I'm very, very grateful to have met you. And I can't wait to see. You haven't really been fully unleashed in the world of dentistry on the lives that you're going to be impacting every day. And so I'm just honored to be in a position to introduce you to dentistry in this way.
Well, I have to be honest. One of the main reasons why I started Smiles for Recovery has a lot to do with you. I mean, the way that you approach that particular course and the compassion that you had, that I felt also. I thought, you know, there needs to be more people like us that are showing people compassion. So you, lady, had a lot to do with that. So I want to thank you.
Oh, thank you. You know, I think one of the things I always say at the end of my topics, whether it's about living, I'm actually serving persons living with HIV or those who have dealt with a history of trauma or substance use disorder, that we need more dental professionals interested in this topic. And we need more of us talking about how important our role is. So give the audience, because, you know, I've heard it, but the audience needs to hear where this all began. Like, why is your interest in creating Smiles for Recovery? What's the why behind it, and exactly what will this organization do?
So the why behind Smiles for Recovery is I am recovering from substance use disorder. And I say recovering because it is you are never recovered, but I'm recovering from substance use disorder. And I felt that, like you just said, there really wasn't enough going on specifically in dentistry. So what had happened was when, you know, the opioid epidemic, you know, was getting worse. And, you know, once I started recovery, I had thought to myself, I need to do something. I need to give back. You know, I need to help, you know, my fellow people. And that's part of the recovery process, you know, is to help, you know, help a fellow addict is the verbiage that they use, but help, you know, another person with substance use disorder. And I thought, well, I don't even know where to really start to do that. But, you know, the two things that I know well, the best in this world is opiates and dentistry. And so if I was going to make any difference, and the most impactful difference, it was going to be putting these two together. So I thought about it. I did a lot of Google searching and researching and finding out what was available out there to individuals with substance use disorder in terms of educating them, finding them access to treatment, those types of things. And I was heartbroken that I found nothing, that there's just so little. And I was like, well, okay, well, obviously that's what I have to do. So that's kind of how it all came about, that kind of quickly and that easily.
So what I felt like was very profound is when we were talking about, in that particular course, I deal with like signs and symptoms. Like, what's the difference between an overdose versus a high? And the challenging part is I've had to learn this information by stepping outside of dentistry, right? Most of the education that's there is simply for the prescribers, dentists, right? They're talking about what to prescribe. And then for, medical providers that are prescribers. And none of them are dealing with like the heart portion, the compassion that we need. Here are some identifying things that we should look for. And what really struck me about your story was the fact that you were dealing with these challenges during school.
Yes.
And it wasn't something that any faculty member would be prepared for. I mean, who is in dentistry, right? Unless you've dealt with it personally.
I mean, who is ever, but,
Yeah.
as well, who's prepared, but.
So what would you say were some of the things that, as educators or as professionals, we need to look out for? What do you feel that could have been of assistance to you during that time?
Well, I'm not sure what could have been of assistance to me, but I can tell you some things to kind of, look for that might stand out that would kind of make you question. As a matter of fact, this past week, I saw one of my old professors, and she is now well aware of my story, was not at the time. But now, everything is very open. And she said, I felt like there was something, I felt like, you were fragile, or I felt like there was something going on, but I had no idea what it was, and I couldn't pinpoint it. From the perspective of me being in hygiene school and still actively using, the number one thing would be nodding out. And we had talked about that in your course, the difference between being high and overdosing. A lot of people think that when somebody is nodding out, that they're overdosing. But that's just kind of the way that we, live our lives.
Right.
You use, you nod out, and then you wake up and then you use. And so, if you were sitting in a classroom and you have someone that you think is falling asleep, it looks the same as, falling asleep, basically, that would certainly, well, you have to be cautious because in hygiene school, nobody gets any sleep because we're studying all night.
Exactly.
But you would get a feel. You would get a feeling. And then there's certainly some intraoral signs that I can describe to people that maybe other dental professionals wouldn't look at because they'd happened to me. So, for instance, when you're using, depending on the administration route, right? So, if you were snorting something, we're going to see some evidence of that in the back of your throat. We're going to see maybe some cobblestoning. We might even see the color of the drug, especially if we're in a dental environment. A lot of times in a dental environment, you're anxious. So you're probably going to overuse before you get there. You're probably going to be in the parking lot using before you get in the dental chair. So when we're looking at the throat, sometimes you can actually see the drug running around the back of the throat, something that you would never even think of, right, unless you were told. There are, people that are on maintenance medications that they're embarrassed to talk about. A lot of those are sublingual or, buccal, depending. There is a pretty high percent of the population that get pretty severe sores due to Suboxone in their mouth, specifically the films, but not the tablets. So, if you see a particular ulcer, in that area sublingually, it's certainly something to question. And having that education, you can say, hey, in this particular spot, what's going on. So those are just some kind of things to throw around that you could look for from those different aspects.
I love that you shared that. And one of the key pieces that really stood out when you were talking, because I'm all about like, let's bust stigma in the face, okay?
Mm-hmm.
Is the fact that some people are ashamed of
Mm-hmm.
saying or have been shamed of saying that they're in a maintenance period
Right.
of their recovery. And one of the key things that I've learned over the course of my trainings is the fact that one of the hardest things to help people keep on that road of recovery is the lack of connection, the lack of support, and the stigma associated with it. So if we have a diabetic patient, and this is one thing I've always heard, if you have a diabetic patient who is taking insulin or taking some more metformin or whatever, we're talking about type 2 diabetes, are we going to just tell them like, stop taking the medication because of what people think?
Mm-hmm.
People who have dealt with recovery will have to be on maintenance, some of them, for the rest of their life.
The rest of their life, yeah.
For the rest of their life.
Mm-hmm. And there's so many people that don't understand that,
Yes.
Evidence-based research is showing us that it saves lives, and that it's okay. And if there's any one particular thing that I could scream out to, my fellow people in recovery or those looking for recovery, is that it doesn't have to be perfect. Just know that. Just know that it doesn't have to be perfect. You just have to keep trying. Yes. And I think that what happens is when you have stigma associated with maintenance addiction treatment, assisted treatment, I mean, you're telling somebody that they didn't do good enough, or that they failed, and I just don't think that we can have that language surrounding it.
Yes, absolutely. Oh, that one hit me. That is so true. And
because I know that my journey certainly wasn't perfect.
Yeah. I mean, whose is though? With anything, anytime we're trying to change behavior, whether you're trying to change behavior in the sense of telling your patient how to care for their oral care, it's hard. Now, can you imagine if you have a biological pull towards something that may be harmful towards your body, or you may be dealing with some other traumas in your life that you're trying to handle by means of using a substance? I mean, there's so many other factors. It's multi-layered, complex issue. And I was listening to Mel Robbins. She was talking with someone. She had mentioned that she was at a conference that was speaking about addiction. And they said the antidote to addiction is compassion. Mm-hmm. And I thought that was so profound to actually hear that.
Yeah, I agree with that wholeheartedly. I think that there are a lot of people out there that continue to want to, place individuals in jail and sweep the streets. And I've heard all of those things. And we've been doing that. It doesn't work, especially doesn't work because we're putting people in the jail system and then having them, withdraw, or we're giving them Suboxone and then not giving them support afterwards. They're just going to go back out and use anyway. So, that certainly doesn't work. But I know, as somebody in recovery, that one of the things that got me to stop using was compassion. So from my own standpoint, I would have to agree with that. And why not try it? Certainly there's going to be no harm of being really kind to somebody.
Absolutely. Absolutely. I've had so many people who have come up to me after these presentations, sharing just like you have, but mostly in private, crying. Many people have said, for a long time, I was mad at my parent, my spouse, my brother, my sister, so-and-so, because I just wanted them to quit. I just wanted them to quit. And now I understand it isn't that simple. And we really need to meet people where they are, and showing a level of compassion is really the first step, in my opinion.
Mm-hmm. And I think that educating yourself, one of the things that I talk about, when I talk, is that you have to, really to make an opinion about this particular situation, you should really educate yourself, because the truth of the matter is the majority of people that are active users of opiates did start from an injury, an illness, and had the doctor prescribe medications. And I, sometimes when I'm on Facebook and I'm scrolling through all my groups, because I have all the different groups, and sometimes I see things about prevention. I see things about, safe injection sites, and I read the comments, and my husband always tells me, don't read, Lisa, you're going to get upset. Don't do it. Read comments. You're going to start crying because people say terrible things.
One of the comments that I received from when I went to go speak in Colorado, I spoke for 6 hours. The first topic I talked about was the opioid epidemic. And the second topic was persons living with HIV, how to deal with that, right? And at the very end, speaking for 6 hours is exhausting. You love it, it's great, but I was exhausted. So at the end, I was approached by an older lady who explained she wasn't sure what to expect with my courses. She did enjoy listening to me, but her comment was, why don't we just let those people die? And then maybe when other people see them dying, which they already are, especially right. Those who are dealing with the overdose epidemic, right? They'll stop using. Mm-hmm. And so that includes many of the people that I've met over the time, including Lisa, who I care deeply about. And I certainly wouldn't want to wish anyone's life to be taken away from them. And it was hard for me speaking for 6 hours and it never reached here. And these are the people treating our patients. Mm-hmm. These are the people that are treating our patients. So what would you say, why does your life matter, regardless of the challenges or the experiences that you faced? What would you say to a hygienist or just a medical professional that feels that way?
Well, I think this also brings me back to the educating yourself that I was talking about earlier. Mm-hmm. The majority of people have either, taken pain medication that was given to them in large quantities. And the doctors at the time really didn't understand about papering and withdrawal and that whole process. So I have heard a lot of people, I'm sure that woman says or believes that, they made the choice to pick up. Why can't they make the choice to put it down? But it doesn't work that way. A lot of times you don't really make the choice to pick up if it's a true medical situation. And then, what happens to the body afterward really makes it not a choice anymore. It really is no longer your choice. And speaking as someone that has been through pretty severe withdrawal several times, I can tell you that it's that it becomes not a choice. I look at myself now. I never thought that I would be in the situation that I am now. When people talk to me and they hear my story, I tell them a little bit about my story, and they're like, I never really would have thought that. And I'm like, well, okay. But then when I get into the nitty-gritty of it, they'll say, I didn't realize it was that bad. When I was living in my house without, electric, without water, when I was stealing, when I was doing all of those things that people with opioid use to sort of do, and I talk about the nitty-gritty, they say, I didn't realize, like, when you said that, you were in recovery, that it was like that bad. I'm like, that's what happens. There's no other place to go, and then once you hit that spot, it's jails, institutions, and that. So yeah, I was that bad. And now I'm this good. And it's like, well, how did you get here? First of all, I'm not this good. I'm still pretty crazy up there. It certainly is a struggle, But what I would want to tell to every dentist and every assistant, and every hygienist, and every anybody really is, it's me. So any single person that you see, lying on a bench, that is using, or somebody that's OD'd, or someone that you see on a bus that's that's the same person as I was. So be careful, one, judging them, and two, whether maybe believe it or not, recovery is certainly possible for everybody, as long as it's available to them and they're ready.
This is why one of the topics I speak on, I've actually just added it to my list, is taking a trauma-informed approach and understanding how trauma puts individuals at more risk for certain conditions, right? For certain experiences. And unless we are looking at the people that we meet, instead of saying, what's wrong with you? We need to be asking, what happened?
Yes.
What's going on? What experiences have you had? And one of the key things that I really love that you mentioned, Lisa, is the fact that there are biological changes. I'll say that one more time. There are biological changes that happen when your body is introduced to any form of substance that you could possibly become addicted to, right? And those changes are as simple as, I love this analogy. This was given by a physician at Johns Hopkins. He used the analogy of a parking lot. You may have about 10 spaces in a parking lot, right? And we have opioid receptors in our neurons, and there's 10 of them. And when we consistently introduce opiates into our system over and over and over again, it accommodates that. It will, because of course, the more you put into your system, the more you need to get that same feeling again, right? That same high. So it creates more parking spaces. So we're going from 10, 20, 30, whatever. Biologically, there's changes.
We just make more. Yep.
That's it. And so when someone says, okay, I'm going to withdraw and I'm going to discontinue my use of this substance, what's going to fill those parking spaces up? And that's why we need that medication-assisted therapy. That is why the CDC reported last year that it's necessary for success.
Yeah, and also, Jasmin, what I've heard, and I read this article, because I try and keep up to date as much as I can, is that there is question right now. Originally, it thought they went back down. Originally, they had thought that, as you withdraw and as you get healthier, those number of parking spots will eventually go down and you will continue on recovery. And now it's thought that maybe they don't. And that is why they're saying that lifelong medication-assisted treatment may be necessary. Because if all of those parking spots never go away, how do you expect us to succeed?
Yes.
So it's interesting to see as that new research comes out, kind of what we're finding about our receptors, and whether they reduce back down or whether they stay to the significant number that they are. So it's interesting.
Yeah, it will be interesting to see what happens. I mean, I know from just the populations I've worked with and talking to some of the overdose response programs here in Maryland, they need it. Like, they need those parking spaces full. Like, there's nothing that has shown contrary, and that's just from personal. So we got to wait for the research to supply us with, the definitive answer. But
yeah, and also, Jasmin, just another thing, because I don't think, how would they? People that haven't experienced this. The moment, literally the moment that I took my first opiate, I knew that was it. The moment. And people are like, that's crazy. I don't know. I don't know what my chemistry, what my mental, and I have some pretty significant, abuse and trauma in my past. And I don't know how that, I'd never been exposed to it before. I took my first opiate and I was like, oh, like, this is what it's about. It's just my body reacted that way. And I'm not the only person that feels that way. It's just strange how that all happens. It was, I'm not going to say it's almost out of my control, because I certainly take responsibility for my actions. But there is a component there that that is tough to fight, for sure.
Yes. And there are people that are biologically predisposed to it. I mean, your experience is contrary to mine. When I had my first opiate after having my wisdom teeth taken out, I was sick. It made me sick to my stomach. I had no desire to ever take it again. Whereas my friend, or even you, it gave you that sense of whatever it was, whether it's euphoria, whatever it's the peace of calm that you need. And so how else do we explain that other than, like you said, the chemistry, the way our bodies are made up? So there are people that will be more inclined or more at risk if they're introduced.
Yeah.
Yep. So I mean, we can go on forever and ever talking about this subject.
I could.
Yeah. So please just tell the listeners, what kind of work are you doing with Smiles for Recovery?
Okay, so Smiles for Recovery kind of stemmed from my capstone project from my bachelor's degree. I graduated hygiene school. I immediately started from my bachelor's degree. I was still actively using, and it took me 12 years to get my bachelor's degree, but I just graduated in May. And
Yay, congratulations!
Thank you. And so my last semester for my capstone project, I had decided to do something that was going to integrate opiates with dentistry. And about 3 weeks probably into the semester, I was like, oh, I'm gonna turn this into a real thing. So I started it at the beginning of this year. We're still in the process of getting our 501c3. It's going through all the things that it needs to go through. But ultimately, for now, what I want to do is I want to go into dental offices. I want to do lunch and learns with all the dental professionals. I want to explain to them what to look for our patients, how to be compassionate, how to not be judgmental, all the things. And I want to show them who I am so that the next time they get somebody in their chair, they will remember me and think to themselves, maybe this person could eventually be a functioning member of society as well. And then in addition to that, I want to start integrating dentistry into rehabs. Now, I'm not exactly sure how I'm going to do that because there's some legal stuff, but I certainly can do it into recovery populations. But I want to start talking to specifically medication-assisted treatment individuals who are going to be on long-term maintenance. They're going to be on Suboxone, they're going to be on methadone. I prefer Suboxone, but again, we come to them. So whatever they're using, and explain to them what those medications will do. So, regardless of if you're still shooting dope in an alley or you're going to the doctor and getting your Suboxone, the actual side effects in your mouth are not different. It's exactly the same. So they need to be made aware that even if they had really great home care, they're still at such a high risk for decay and infection. And then why finding a dental home and then, going in for regular checks are so important. Kind of what they can do to offset some of those side effects from the medication.
You're a blessing. Oh, that's wonderful, Lisa.
I'm so excited. I just want to go.
Yes, I can't wait. And she did not mention that she is in a graduate program right now at Phone School of Dental Hygiene, which is awesome. Hey, Phones, we love you. So I can't wait to see even more how that grows and what comes about, the new information that you're learning and the new skills that you're learning to enhance your journey. So, final question. What was the best personal or career advice you've ever received?
Oh, my best personal advice or I mean, probably what I mentioned earlier, which was recovery is not perfect. I mean, at some point somebody had said that to me. I love the quote from J.K. Rowling. I have that on my Facebook page, about rock bottom. But I'd have to say, stop looking at your past. You don't live there anymore. I have to remind myself of that every day because it's still a struggle. It's still a struggle to not still think I'm that person, not walk into a room and still see myself. Nobody else sees me, as, quote unquote, a junkie. So it's getting through those, a lot of therapy, getting through those hurdles and just remembering, stop looking back at your past. You don't live there anymore. And just kind of telling that to myself over and over again.
Thank you for your courage and your bravery, Lisa. Please tell the listeners how they can contact you, how they can find out more information.
Okay. Like everyone else on earth, I do have a Facebook page. So it's Smiles for Recovery. It's Smiles, the number 4, and then recovery. And then I also have a website, and my website is smilesforrecovery.com. So you can certainly take a look at those and see what we're all about. And if you want to help and volunteer, we would love to have you join on the train.
All right. Well, thanks again, Lisa. This has been an awesome conversation.
Thank you, Jasmin. You're the best.
Thanks for tuning in to the show. We value each and every one of you. Dive in deeper by visiting the show notes for this episode or listening to more episodes on beyondtheprophy.com. If you found value in the show, share with a friend and leave us a review. We will see you next time, BTP family.